presentation is from Trudy McGuinness from the Department of Health. She's going to give us a program update. So just have a little stretch and a little move, and I'll call you back.
Yeah, maybe people could use the time to fill in the evaluation as well.
Absolutely. That's a great idea.
Thank you.
Okie doke. Trudy, are you, I'll get Ben to put up your presentation and we'll get started.
Thank you.
Thanks,
it looks
Ben.
like it's already up. Thanks, Ben. Hi, everyone. Hopefully everyone's back from their leg stretch. Just scrolling through. Anyway, that's okay. I'm Trudy McInnes, and I'm the Director of Preventive Health and the Renal Policy section in the Indigenous Health Division in the Department of Health in Canberra. And as part of that, a big part of that, I manage the Tackling Indigenous Smoking program from Canberra. Thanks, Ben. So what's happened over the last year? Towards the end of last year, the ABS produced updated data on the National Aboriginal and Torres Strait Islander Health Survey 2018-19, and that included a bunch of stats around smoking. And what it showed us was that around 4 in 10, 41% of Indigenous people smoke over the age 15. 37% smoked every day. Another 3% smoked but not every day. The proportion of people who smoked every day was 4% lower than when the last time the survey was held, which actually it sounds like a small number, but it's actually quite a significant number. It's around the same for women and men. It's higher for people, as Tom has mentioned previously, living in remote areas than in non-remote areas. And really pleasingly, it's lowest for people aged 15 to 17 years compared with around 40% for all other age groups. And yeah, people aged 15 and over who smoked every day averaged about 12 cigarettes a day. Ben? The good news is that the proportion of people aged 18 years and over who smoked every day steadily decreased in non-remote areas from 49% to the last time the survey was held in 2004-05 to 37% in 2018-19. And the proportion of young people who have never smoked between 2012 to 13 and 2018-19 increased from 77 to 85% for those aged 15 to 17 years, and from 43% to 50% for those aged 18 to 24 years. So that's a bit of a mouthful, but what it tells us is that younger people aren't smoking at the same rate as their predecessors did, you know, people a generation up from them, and so that's really, really pleasing news. The bad news is that the proportion of people in remote areas aged 18 years and over who smoked every day did not change significantly between 2012-13 and 2018-19. Thanks, Ben. So in response to that, we had there's 2 priority population groups for TIS this time round, as I'm sure you're aware, they being Indigenous pregnant women who smoke and people who live in remote areas, and that's sort of demonstrated through that data. And so with some funding that we had to do whatever we wanted with, basically for remote, we consulted with a bunch of experts in the area, and basically the feedback we got was we just need more investment in remote areas. And so we've done that. We invested more money into Congress and into 2 new areas, Torres Strait and the Tiwi Islands, which is fantastic, and also another new area, Worley. Catherine does already have some TIS funding, but not that part of Catherine. So that's really good and exciting news, and we're really happy to have those organisations and areas on board. We've also commissioned Circa, who does the standard evaluation of TIS, to do a bit of an in-depth evaluation of these 4 new remotes, so that we can try and find out if there really is anything that's different about remote to non-remote. There isn't a lot of evidence around it. Anecdotally, there shouldn't be, but we'll see if Steffi can come up with some findings for us in that regard, which will help us into the future. And we've commissioned the NBPU, or we've given the NBPU a bit more money to, or not, to resource to find a resource to dedicate to the new sites and to remote more generally. And I'm pleased to advise that that is Benjamin, our Zoom facilitator today. Congratulations, Benjamin. Next slide, please. So what's happened over the last year? Again, we've also established, in response to the situation in remote, and through an approach made to us, a Northern Territory Remote Indigenous Tobacco Control Working Group. So Professor David Thomas, who Tom mentioned earlier in his presentation around the impacts of smoking and stress, who's done quite a bit of work on that. He's really an expert in Indigenous smoking. He's based in Menzies in the Northern Territory, and he's already involved in the Northern Territory government-based tobacco type working group, and he thought it would be a good idea if they partnered with the Commonwealth to do some work together. And that was taken to, so every state and territory has a forum where they have the Commonwealth, the state or territory, and the peak body for Indigenous health, and a few other people around the table. And so that was taken to the one in the Northern Territory, and they agreed that we could establish a working group that would sit under that and work in a really dedicated way around coming up with ideas and solutions to the high numbers of Indigenous people who smoke in the Northern Territory. So that's been going since April, and what will likely come from that is learnings that can then be applied to other remote areas, or tools or resources that can be applied to other remote areas across Australia. But that's a bit further down the line. So the specific focus at the moment is on the Northern Territory, but that's a really exciting thing because David Thomas, Professor Thomas, is very expert in that area. Thanks, Ben. Some of you might be aware that we had a smoking and pregnancy roundtable in February, which seems like a million years ago now with everything that's happened since then. It was chaired by Tom, so Professor Karma. We had about 35 people attend, a lot of whom did present. So it was really, the participants were really people who already work in this area or who have worked in quite a dedicated and thorough way in this area. And it was here from all of those people that did come from different perspectives, so from academia and also from a program delivery based type perspective, on their views, their experiences of working with Indigenous women who are pregnant and who smoke, and how to try and bring those numbers down. It was a really fantastic event, and we had a scribe on the day who's produced a report, and we also had all of the presentations recorded, and I'm pleased to say that all of that information now is available on TISBRIC. So I've put the link in there. It's under resources. So those, the many people who would be interested in this topic who couldn't attend on the day can still benefit from what was really rich and meaningful conversations and presentations on that really important topic. Thanks, Ben. In terms of governance, the NBPU had a advisory group because back in the day when it was first setting out, that was something that was useful then, but now it's thoroughly up and running, and so it was agreed that it would be expanded to a technical advisory group for TIS more generally. Tom chairs that, and we've had the first meeting in May, and we're going to be having another meeting in the next few months, and it will be an opportunity to hear from a lot of experts in tobacco generally, as well as in Indigenous tobacco, on what else we can do to continually enhance and improve the TIS program, and to get their advice on important issues that arise. Circa, in terms of administration, as you would all know, finalised the performance report and activity work plans and templates in the monitoring and evaluation framework and performance indicators, and a data variation was progressed to change the reporting timeline. So that's all happened quite a while ago, but that did happen over the last year. Thanks, Ben. And we've continued to work with Raglan and the ANU on the work that he's described that he's doing. Circa on the work that Tom described they're doing. Tom, we have a very strong and robust and meaningful relationship with Tom. He has an office on our floor, and we see him quite regularly, and that's really useful and helpful and important. The quit lines. So we know that they have probably been the poorer cousins out of all of the 8 components of TIS, in that we haven't given them probably as much attention as we should have, and we're trying to rectify that, and we've had one meeting with all the quit lines at the Oceania Tobacco Conference in Sydney last year, and we're holding the next one in September, so we can get a better handle on what's going on with the quit lines and the sorts of issues and that they're experiencing, and having a better understanding of how they're operating. We've also had a few meaningful discussions with recently with the Cancer Council South Australia on quit skills. So they have a new program manager, Sarah Aegis, and we've had a chat with her and with Tom around quit skills and the future of quit skills and what direction it might take, given that it's been running successfully now for several years, and what else can it do. And they're also, I'm not sure if Tom mentioned this, doing some work to deliver online program delivery. So that also is a really exciting change for the program. Also, as Tom mentioned, we work with the DSS Community Grants Hub on grants administration. It's really not an ideal situation. It means that we're one step removed from the nuts and bolts of what goes on sometimes with your activity work plans and your progress reports, because they see them and they evaluate them, as does the NBPU. We see them by exception or unless we ask for them, but we're trying to improve our understanding of what's in those reports in a way that's doesn't duplicate effort, but is still meaningful for us and our understanding of what's going on. We have a good relationship with DSS. It's just the way that it is in terms of this situation, and we all try and make the best of it, as I'm sure you do too. And I'm sure possibly at times you feel a bit frustrated with the setup as well, but as we soldier on as we do. And the University of Newcastle, we have contracted to deliver iSisterQuit, which is similar to its SisterQuit program, although not as as part of a randomised control trial. And Professor Gillian Gould will be talking about that soon. Thanks, Ben. We also, of course, are all mired in COVID. And when COVID first hit, no one knew what was really going to happen to anybody, to the world. We had a few requests for TIS funded organisations to reallocate their TIS teams to the COVID frontline. We took and it wasn't just TIS, it was a whole bunch of other programs that the department funds under the Indigenous Australians Health Program, and we made a program decision that on a case-by-case basis that would be permissible for a certain period of time. Fortunately, it hasn't required the effort that we might have imagined it could have in the very beginning, and so we really feel that all TIS teams should now be continuing to work on their TIS if they weren't already, and their TIS efforts, and which are in fact COVID related when it comes to protecting the more susceptible and vulnerable people who are smokers from COVID by encouraging them to quit smoking. And so if there are any questions about that, happy to respond on what the situation is now around permitting people, TIS teams, to work on COVID. Thanks, Ben. The other thing that we've kicked off is a bit of a look at underspins from TIS teams. And this came about because of a particular organisation that was carrying a reasonably significant underspin, and because of the situation between us and DSS and so on, we didn't have any visibility of it until it was too late and the money was lost, meaning that it gets taken away from your organisations and goes back to the government, but not necessarily to Indigenous health. So that's something that we really want to avoid, because any loss of money to TIS is a loss of potential lives saved, and it's really important that organisations make sure that they're spending the money that they're allocated. And I know that particularly at the moment with COVID and people have travel budgets that they're probably not using, and it's really thrown a spanner in the works in terms of some organisations' plans. There are still other things that the money could be spent on, and it's really important that that happen. So even outside of COVID, we know that in 2017-18, $425,000 was lost to TIS because it was taken back and then spent on something else in the public service, not Indigenous related, and $264,000 was lost in 18-19. So please, if you are carrying an underspend from last financial year, have some really good plans ready for a rollover request, and because they're not always necessarily going to be approved, they need to be really good and appropriate. And if you have any issues around that and coming up with ideas, if you are carrying an underspend from last financial year, please speak to the NBPU. They have really great ideas about what TIS funding can be spent on. And also in this current financial year, we're in September, so we're a few months into this current financial year, and you would be having a think about, maybe I'm not going to use that money that I thought, the travel restrictions are extended. I apologise, I'm not quite sure of your travel restriction arrangements over there and what that means for you, but if it has impacted upon you, then maybe do you think about other things that you could be doing with your funding, so to avoid any risk of it being lost to the program. Thanks, Ben. So yeah, our plans for the next year are to continue to focus on our two population priority groups, being remote and pregnant women, and just generally continuous quality improvement. I've already mentioned the quit lines, the quit skills. The NBPU is doing a thematic review of your activity work plans, just to have a look and see. As I mentioned, DSS gets all of your individual reports, as does the NBPU. We don't, and we'd really like to see a summary of what's going on and what you're spending your time and effort on and what activities you're doing, and see if there's any kind of themes that emerge from that, or it tells us something interesting about the work of TIS on the ground. So that's progressing, and we'll just continue to work with stakeholders on identifying the best use of resources. Thanks, Sam. And any questions?